introduce our speaker um, for this afternoon. So our speaker for this afternoon is a public health nurse with the Toledo Lucas County Health Department. Her role of lead case manager with the Childhood Lead Poisoning Prevention Program, teaming with an extraordinary team of lead investigators. She's an active member with the Toledo Lead Poisoning Prevention Coalition, advocating for lead-free environments. Gloria is very active in our community with organizations that provide stability and hope to its citizens. She is the lovely wife. She has two daughters, grand and great grandchildren. She is an avid bicyclist who loves to travel and loves a good book. Please help me welcome Nurse Gloria C. Smith.
Yay, Gloria.
Thank you,
Welcome.
Sanchez, so much.
You are welcome. Are you able to pull up the presentation app?
Yes, I believe I am. Let me get to the beginning of it. Can you see it?
Yes.
Yes.
Okay, can everyone hear me?
We can.
Okay, good evening, everyone. First of all, I would love to thank Sanchez for the wonderful introduction and all your technical support this week. I also want to thank Freshwater Future for their vision and collaborating with our city of Toledo on doing works with our lead pipes here in our city. So thank you so much. And again, B reached out to me originally with the city of Toledo to get this collaboration started. So thank you so much for the opportunity. And also want to thank our listening and viewing audience for being a part of this as well. So thanks for much. So we'll get started.
Open the door. Open the door.
You know what, Sanchez, I think I'm okay with the slides. I think I was having some difficulty seeing it. I just want to start off by saying that Lucas County, at any given time, there are approximately 3,400 children that we consider to be lead poisoning. Think about that number, 3,400 children in our community that are considered lead poison at any given time in our county. Next. Now, was there a slide with our zip codes? One thing was that, yes, one thing I just want to mention real briefly as well. Based upon our, what we consider to be high-risk zip codes, there are 18 high-risk zip codes in our county. Next. And I'll just give a brief overview of lead. Lead is a heavy toxic metal. It's commonly found in paint and pipes in older homes. If you all can imagine a grain of sugar, that much lead is enough to make a child toxic. And just to clear up some of the transmission, I think that, you know, growing up, and we always think about lead poison and how children are affected. And I think that the first thing we think is that they eat the paint chips, which they do, but most of our children are actually poisoned by the lead dust that they breathe in. So when we're seeing any of the old paint, you know, there could be 5 layers of paint, but once it starts chipping or alligatoring, it creates a lead dust. So the children are actually poisoned by the lead dust. It is also transmitted through hand to mouth contact. It can also be transmitted between mom and her unborn baby. So most of the children are actually poisoned by inhaling the lead dust. And back to the paint chips, children are drawn to those paint chips because the paint chips are actually sweet. The lead is sweet. You know what, Sanchez? I'm having a problem seeing the entire screen. The entire, yeah.
Am I doing something wrong, Sanchez?
You know, now I see the freshwater logo there. But I think we can get through it. We can try it. Okay.
Are you able to see it better now?
Oh. It's still, part of it is obscured. But I think I might be able to work around it. So we'll just go ahead. We'll get through it. There are some lead testing requirements here in the state of Ohio. Children that are on Medicaid or Medicaid product, they are mandated by the state of Ohio to be tested at age 1 and 2. So we have a lot of children that we actually capture when they're tested at age 1 and 2. But then what do we do with children that are older than age 2 and they're still becoming lead poison? And that's just a thought for you all. So as we go through, remember that, you know, we kind of need solutions to that if we're only testing a certain group of children. But we do capture a lot of those children. If the children live in certain high risk zip codes, it is also a state law that those children are tested. There are a set of questions that physicians or other providers should be asking parents that would indicate to us that they could have high lead levels. Of course, if they live or regularly visit a home that was built before 1950, if they live in a home that they notice peeling or chipping paint inside or outside their home. Also, a home that is built before 78 is always suspect. And we also question whether a child has a playmate that has lead poison. So if a parent or a guardian answer yes to any of those questions, that child definitely needs to be screened. Next. These are the medical recommendations, and these are recommendations that physicians use. Once a child has been identified with lead poisoning, I'll just be real brief on that. Here in the state of Ohio, every laboratory, they are mandated to forward all the children's lead levels to the state of Ohio. Once the state of Ohio get those lead levels, they are then sent down to all of the counties in the state of Ohio. So here in Lucas County, we get all those results from Ohio Department of Health. And we also have many physicians and providers that will fax the children's lead results to us. And the doctors are also required to follow a certain regime based upon that child's lead level. Next. That is a really blurry, but we can always get that to you. Lead poisoning. These are just some of the behaviors or conditions that are caused by children with lead poisoning. And you can all see those for yourself. The nausea, decreased IV, IQ. There's a very high rate of incarceration. We had a professor here in Toledo that worked on a project tracking high lead levels with young children and then how they end up being incarcerated. And there are men and women in our system, criminal system, that have high lead levels. And those levels were there as children. The nerve damage, the seizures, tremors, abdominal pain, and then death. I just want to share a real brief story with the death. I've been doing this job in lead case management for approximately 7 years. And I've never come across a child that died of lead exposure. But when I first took this job on, we went to Columbus for a workshop, and they shared a story with us. A child, a parent purchased a pair of tennis shoes for a child. And you know how they do the promotions, there was a locket, a free locket giveaway in the box of shoes. Well, a child swallowed the locket. And when the child died, and when they did the postpartum, he had been lead poisoned. So he was lead toxic and died. So we do see that currently we're working on a project to see if there's any correlation with children that die before the age of 1, and if some of those deaths are related to lead poisoning. So our health department, with our Healthy Start program and our epidemiologist that works with our Healthy Start and a project with Mercy, we're beginning to look at that now. And even when we see children that die of SIDS, we're now beginning to wonder. What's really interesting is the demographics that we see children with the high lead levels. It is the same children that are dying before age 1 in our county. So we think that there may be a correlation. Next. And these are some of the health risks. And we saw all of that on the previous screen, so I won't belabor this point, but we do see damage to the brain and central nervous system. We see learning disabilities, and a lot of these behaviors cannot be reversed once a child has been lead poisoned. One of the things that is really important to us with dealing with lead, we find that the sooner a child has been identified with lead poisoning and we begin to work with that family in decreasing those levels, the sooner, the better their outcomes. Next. This is kind of a repeat of the previous slide that just talks about the repercussions of lead poisoning, how they're far-reaching from, infancy through adulthood. Next. These are sources of lead. And what's interesting about this, can everyone see this diagram?
Mm-hmm.
When we go into the home, it's an animated piece, but when we go into the home, these are some of the things that we do assess, and this is where we always see lead. Lead can come from old plants and factories that are just kind of sitting idle, and even factories that are currently they produce airborne lead. We're still finding lead in our toys. What's unfortunate, the United States continue to import items from other countries that don't have the same regulations with lead. I keep a list of all of the products that have been recalled due to lead. And what we're seeing items that have been imported. We're seeing baby cribs, we're seeing baby toys. We find a lot of items in dollar stores that are made in other countries, China. So we are still importing items with lead, and that's a lot of my education and educating and informing families of that. You all see that lead, that garbage can there. Some of those metal or lead or those metal cans, they still use lead to solder it together. They're still using lead for that, but we see it everywhere. And you see the little puppy there, or it may be a cat, I'm not sure. But when we go into a home, and if there are pets in homes, one of the things that we educate on, if you have an animal that is outdoor, indoor, and he's rooting in the dirt, there is lead in our soil. So if they're rooting in the dirt, one of the things that we encourage our families to do, at least wipe their paws off when they before entering into the home. You all see the airborne lead. I have to share this story as well. We have a battery plant here in the city, and we're seeing a lot of children affected because their parents are working there. That's all I'm going to say on that, though. I just want to kind of share with you where, how, and why kids are being exposed. Next. This is just a slide that, first of all, with our old housing stock, we're seeing a lot of children being exposed. I'm going to say probably 98% of the children that we open lead cases on are exposed by their homes. It could be the peeling paint. It could be the old leaded pipes. So thanks again for Freshwater, what you do with these pipes. This picture is actually a pictures from a home that family were living in. Here was the situation. Family desperate for housing, moved into this home with the agreement with the landlord that they would fix this home up, renovate the home, and they're going to continue living. This is the condition of the home when we walked in after the child has been identified. The child that was identified in this particular home had a lead level of 38. I didn't mention yet that according to CDC, Center for Disease Control, and also Ohio Department of Health, we are to take action when a child's lead level is at 5 micrograms per deciliter. This child's lead level was at 38. And one of the things that increased his lead level, his parents had already started renovating this property. So they had started already scraping paint and started doing some renovations, but what it was increasing the lead dust. The picture on your left was actually the exterior of the home. Real business. Next. As we know that this is a huge source of lead, and you all may want to investigate and dive into the work that Freshwater Future is doing in collaborating with the city of Toledo to address our old pipes. One of the things is when we initiate an investigation, we do talk about the water and we do talk about the lead that's in the plumbing. And so one of the things that we look for to see if some of that plumbing have been converted to the PVC and plastic pipes inside the home, because we do know that if there is, and you know what, and we're not even talking about the pipes that's outside the homes, which is the biggest culprit, but the pipes even inside the home that's coming into your faucet. If those pipes are still the old pipes that were put in those homes 50 years ago, when you turn on that hot water, it's going to leach lead from the pipes. That's all I need to say on that. Next. We also find lead in imported spices, in tin cans, and also we have found lead in not so much the Mexican candies, but it's on the wrappers. And if you look in the upper right-hand corner, you see how colorful and festive they are. Lead is used as a product to bind paint upon the product, whether it's paper or a house, ceramics, or china. Lead is used as a bonding agent to help it adhere to the product. And as I mentioned earlier, in other countries, you know, they still manufacture tin cans and they use the lead to solder those cans together. Okay, next. We also find lead in cosmetics. We at the health department, when we're opening up a case, we want to believe that we are culturally sensitive. So when we open up a case and go into homes, we focus on who those individuals are in the home. And in certain cultures, they rim their baby's eyes with a cosmetic called kohl. Some of you have probably heard of that, KOHL. But we also found that kohl, some kohl products have lead in it. And we have found infants, newborn infants, you know, it is a ceremonious, what I want to say, ritual, the rimming of the kohl with the eyes, but we have found those babies have high levels of lead. So you know what, we've got so much education to do. Also, we have found lead in window blinds. If the window blinds have been compromised at all, if they're bent or if they're torn, they will also emit lead dust because some of those blinds have been painted. So again, you know, the lead helps the paint adhere to the blinds. And when we talk about points of friction, I just want to say this real briefly. Where we find a lot of lead dust is created, you know, if you're having an old home and the windows have not been replaced and the windows, the door jambs have not been replaced, that's what we see. Every time a family or visitor open and close their doors, they're creating friction. In your window jambs and your window sills and your window troughs, and also on front porches. We have a high incident of children that are poisoned from their front porches. Guess where those babies play? On their front porches. And not only are the babies playing on the front porches, but if that is the entry that everyone uses, when you walk on a front porch that have been repeatedly painted and we're down to the original paint with the lead, they're tracking that lead dust into their homes. Next. I mentioned earlier that I try to keep track of items that have been recalled due to lead. These are some of the items that we found that had lead in them. Tinker toys, painted metal trucks, jewelry. I do caution families from purchasing little girl or boy costume jewelry in the dollar store, and look to see where those items have been produced. Sometimes a test is if you take a piece of costume jewelry or a toy and you kind of rub it between your fingers and you'll get a little gray smudge, that's lead. Next. Another point of assessment for us, you know, when we're trying to identify a source of lead, there is a risk of exposure with fishing, and that's because the sinkers are lead. You know, so we do have families, you know, dad takes the kids out on the fishing bank and they're handling the sinkers. We also talk with families about, you know, if they may work in automotives or work in any type of factory where there are metal parts and moving parts such as assembly line, those type of occupations can also cause lead exposure, because now, dad is in the plant, there's lead dust in his hair, on his clothing, and he's taking it home. We have actually tested parents' boots, and we do find high lead because now they're bringing it to the home. But we educate to prevent those future exposures. As I mentioned, the battery plants, that's also in our literature. People that make jewelry, and people that do hobbies and crafts where it may be stained glass, that's also a source of exposure as well. Next. Just to share with you all, how are we with time, Sanchez?
We're doing okay with time.
Okay. Okay. Now, I talked a little bit about lead poisoning, some of the effects that it have on our children, some of the things that causes a child or an adult to take on lead poisoning. And just to share real briefly about what we do with our program at the health department. There's a lot of other things that's going on right now in Toledo that I'm so excited about it. And we'll talk about that as well. And I'm so glad that Sarah joined us, because she can always pipe in as well. But what we do is, once a child has been identified with an elevated lead level, we go into action. So what we do is, our first thing is to reach out to a parent or guardian. And we initiate a questionnaire, and it's a tool that allow us to see what the possible source is. And we can almost identify that source prior to getting into a home. We want to first start off with educating a family. If I contact a guardian and they are in the middle of remodeling or renovating the property, we tell them to halt that practice immediately, because you're further stirring up the lead dust. So that's the first thing, is to get them educated even before we get into the home. And then we schedule what we call as a risk assessment. And what that entails is, I work with a fabulous team of lead investigators. And what they do is, they are focused on the home, and I focus on the child and getting that lead level down. So we go in and we do a visual assessment, and we also use dust sample. We collect dust samples, and we also use an instrument called an XRF gun, which is an X-ray gun, and it can go through layers of paint. While we're in the home, we also do a 6-point environment healthy home assessment. We like to make sure the lead is our primary concern. But when we get into the home, if you have a family that's living in an unhealthy environment, lead is not the only problem. We see problems with electrical. We see a lot of safety issues where there's not a lot of lighting. We see electrical wiring that is not in the wall. We see hot water tanks that are exposed. So we do an assessment, making sure that families are not living in infestation and their plumbing is working. So I'm real proud of that part that we add to it. Also, once we go in and do an investigation, our lead investigators, they put together a report, and in the report, we'll share with the tenants, the homeowners, and or the landlord exactly what we found in the home. So we report to them where we found the lead, how much lead we found, and exactly what they need to do to remediate the problem. We also can refer a family or landlord to our cities. The city of Toledo have a lead abatement program that can assist them with doing the remediation and the work. Our work is ongoing because once we go in and assess a property, put the orders on it, our lead investigators are actually charged with doing an ongoing monitoring of that property. And the reason for that is we can go in and say, okay, this house is no longer, you know, this home is no longer possible for a family to live. Well, that family will leave, but we find that our landlords will come back and move another family into that same dwelling, although there's orders on that home. So they do continue to monitor that property. Next. Next, yes. There is something that we can all do in this process. One of the things that we share with our families and people that are looking to rent property, or people that are also in the market to buy, to ask if the home is built before 1978. Actually walk through the rooms and see if you have identified any peeling or chipping paint, just to make sure that this home is lead safe. And then we also ask of our landlords and the owners and people that are selling the property, check regularly for the peeling paint, keep the property well maintained, contact the health department if you have any questions or concern regarding the property, and make sure your property has been certified lead safe and environmentally healthy. And we'll talk a little bit more about that as well. Next. Before we go on to the questions, I just want to say this. We're talking about some of the things that we are currently doing here in Toledo to address our huge lead poisoning. I had the pleasure of becoming a member of the Toledo Lead Poisoning Prevention Coalition. It is an advocacy group, and we were instrumental in help pass a local lead ordinance in 2016, but then the law was blocked. And in 2019, our coalition demanded action and the law was actually passed. Now, Sarah can kind of help me with this, how this coalition was instrumental. And today we have the City of Toledo. We're in collaboration with the City of Toledo, our advocacy group, and they have since hired a lead safe coordinator. So she works along with our coalition, and we're really making things happen. So we're really pleased with that. Sarah, did you want to add anything to our coalition or with the City of Toledo and some things that we've got going on?
Thank you so much, Gloria. Can you hear me okay?
Yes.
Thank you. I guess I would just say it's important for people to know, now the lead ordinance, the deadlines have not gone into effect officially yet. They will start next year. But it is important, especially for renters, to know that it is the landlord's responsibility to address the lead hazards. So that's something that's really important for tenants to not only know about the hazards, but that it is the landlord's responsibility to address those. And certainly there may be situations where landlords may threaten eviction or other types of retaliation for tenants that are complaining about lead hazards or other health hazards in the home. And that is definitely an issue that should be addressed. We're here to help with that. Also, other resources like Legal Aid and ABLE can be resources if that's happening as well.
Thank you, Sarah. Don't go anywhere, Sarah. Questions are coming
I'm not. I didn't want to steal your thunder.
I have no thunder, so I'm glad that you're there for support and can answer some of our other technical questions. Are there any questions based upon the PowerPoint? I kind of went through it pretty fast, so I'm open for questions.
Sarah, can you hear me?
Yes.
You had mentioned the professor at the university who did the lead study for child-led blood levels. Do you know what the findings were? And was that Dr. Marilyn Woods and Dr. Morris Jenkins, or was that another study?
It was Dr. Marilyn Woods, and I'm sure that she has those stats.
Okay.
Yes, the result of that study.
She linked that study to cognitive disabilities and suspensions, correct?
People that are in our criminal system, the penal system.
Okay.
Yes.
Okay. All right.
Gloria, this is, oh, go ahead.
No, I was just going to say, I'll look for that information and maybe that may be something that we can educate our community members on.
Absolutely.
Yeah, most
And you know
certainly.
what? I will track that as well.
Thank you so much, Ms. Gloria.
Mm-hmm.
So, Miss Gloria, in the beginning, when you were talking about the screening for 1 and 2-year-olds, and then you said, you know, we kind of stop. So I guess my question would be, what's your opinion, or what do you recommend that we should start to change to start screening older children?
I think that anytime a child has a child visit, infant, toddler, or child visit, I think they all should be screened. Here's the thing. When we think about lead poison, we do know that brown and black children are affected disproportionately. We do know that. We also know that children that live in poverty are also affected at a higher level than other children. But what I'm seeing is those faces are beginning to change. I'll give you an example. And even when we talk about the demographics of children that should be tested, children that live in within the city limits and they're living in old housing, of course they should be tested. I think at all ages. I also think that children that even live in rural areas that are living in old farm homes should also be tested. So I think that sometime that criteria limits us to who should be tested. You know, I think that when a child walks into a pediatrician office, they're 2 years old, they're African Americans, they live in a neighborhood that has been underserved, and they automatically test that child, which is wonderful. I have also seen mothers that have children with extremely high lead levels that are living in older neighborhoods. What's interesting is the face of lead poisoning is changing. I am seeing also children that have white faces. They have parents that are now coming back into our older neighborhoods and rehabbing and remodeling homes. So there's no specific face anymore to lead poisoning. So I think children should be tested across the board. I've had Caucasian mothers plead with their providers to lead test their children. And when those children are lead tested, their levels are high. So I think that doctors should continue to test children probably up through grade school. You know, at least test them until they're 6 or 7 years old. The program the program that we have at the health department is actually a mandated authority of Ohio Department of Health. So we utilize their mandates to run our program. So our program covers children between the ages of 0 and 6 currently.
Okay. Any other questions?
I know that there's a lead abatement, and I see Director Eunice on, who deals with a lot of the housing issues within our communities. Eunice, have you been in any conversations in regards to the housing that relates to lead abatement? And if so, are there things that our Ms. Gloria can help us understand for some of our homeowners?
Okay, now Alicia, are you speaking to the current available monies to remediate property?
Yes.
Currently, and Sarah, you can help me with this as well. Currently, the City of Toledo Department of Neighborhoods hold a HUD grant, and that grant is available for lead remediation. And you know, of course, just like everything else in the bureaucracy, there is red tape associated with that as well. And one of the problems that we see with that is the criteria that people have to meet to be eligible for the grant. First of all, they want people to be current on their mortgage payments, and they also want to make sure that people have home insurance. So what would be wonderful, and this is something that we've talked about in our lead coalition meetings, how to assist people with those type of things. You know, we've had individuals that purchase property, be it land contract or rent to own type of agreements. And what's interesting with that is once the deed have been transferred, the new homeowners also acquire the back taxes with that. And I think when we talk about educating, those are some of the educational points that we need to emphasize with people, you know, in dealing with purchasing property with land contract and lease to own leases. And with our ordinance coming down the pike, they're going to also be responsible for making sure that their property is lead safe. And so they're entering into these agreements without that knowledge.
Okay.
So yes, Alicia, I went off on a tangent. Sorry about that. But
no, thank you for the tangent. It's so important.
And there also, there was a lawsuit brought on due to some environmental lead issues. And so there's also a grant that has been made possible through BP oil. So that's also available as well.
Okay. And what about, I know I'm asking a whole bunch of questions, but I'm getting the text messages from folks. What about individuals who own some of these at-home daycares? Is there support for that?
You know what, you mean as far as being eligible for grants or funding?
Yes, to have their homes lead safe. And from what,
and you know what, Sarah may be able to speak to this. I would say yes, because they're the owner of that building. Would you say that so, Sarah? That they would also be eligible for monies for potential remediation of properties?
I am not sure about the eligibility of the grants. I think it would also depend on which grant, which funding source you were talking about. I do believe, however, if I'm not mistaken, that daycares were included as part of the lead ordinance. So I think that I believe that they are required to be lead safe under the lead ordinance.
Correct. And I think with the daycares, they're actually part of our first phase in implementing that.
I have a question.
That's something that I can check into. Would daycares be eligible?
Gloria, can you hear me?
Yes.
Okay. I wanted to know, I have a question about the filters. A lot of the members in the community are receiving letters about, the work that's going on in Junction. And maybe Beatrice can help answer this. When will filters be delivered, or how will filters be distributed to the residents and community members when this work is being done on the lead lines?
Now, that would definitely be a question for Beatrice or maybe Freshwater as well.
Okay.
Hi, this is Beatrice. Always when we are repairing lines, we do provide filters, but I'll follow up and find out where we are on that, and I'll let you know.
Wonderful. And Beatrice, if there could be an address or mapping where maybe some of our community groups that are on Steve Seaton, Frederick Junction Coalition, Monroe, all of our 6 communities, maybe if we had the map, we could help to ensure not only the education that Freshwater Future is providing, but also the safety to ensure that those families are aware that they should have a filter on their faucets.
Right. So I can expand a little bit on that. So part of this project, because it's tied to drinking water, we are working with a company that's using a software that is helping us be more precise in identifying homes that may have lead. And part of the product that will come out of that will be a map. And that map will allow it to be a very interactive map that you can go in, put in the address of where you're staying, or of a place that you have an interest of. And it will give you information on that, on the probability that that home or that structure has lead. So that is in the works, and it's part of this environmental justice grant. And for those who may not be familiar with this grant, we were awarded a grant by US EPA Office of Environmental Justice. And the whole purpose of getting that grant was to work with communities and use technology that is available now to better pinpoint homes that have lead, because we know that if there is a home with lead, then there's a greater chance of exposure.
Thank you.
Thanks, Beatrice. So,
I'm letting folks listen in.
okay. I have another question for Gloria, though, too. I know that eating healthy produce can help to remove some lead, but I don't, how much? And can you tell us more about that?
Yeah, we do know that, considering that lead is a toxic metal, one of the things that we know that can assist in eliminating the lead from a body would be food and drink that's high in iron. And in order for the iron to work properly, a child or adult would also need calcium, foods and drinks that's high in calcium, and also in vitamin D. One of the challenges that we have is when I open up a case on a child, I do individual care plans on each child, because each child have a different challenge. And the child that eats a well-balanced diet, high in iron and high in calcium, low in fat, those children are able to excrete the lead from their bodies at a higher rate. What's really interesting, I do have a large amount of children that are autistic on my caseload. And I find that those children sometimes have more of a challenge just because of their large likes and dislikes with certain foods, certain textures. But there's always a way how, we can intervene, whether we do smoothies. And I do find even with the smoothies, if, throw cabbage and kale and spinach into that, where you're getting the dark green leafy vegetables. So to your question, foods that are enriched in iron, calcium, and vitamin C and D. You know what the first thing with children is, you know what? Children can eat a pound of kale a day. And if they are still being exposed to the lead in their environment, their lead is not going to decrease and the children are going to take on lead.
Yeah.
So
that's right.
the first thing, you know, when I first have my initial contact with a parent, first of all, you know, I just kind of want to share that when we talk about impact that lead have on children, just real briefly, the impact that lead poisoning have on families, you know, the first emotion that a mom, a dad, or other guardians feel is guilt. You know, that I've moved my baby into this environment and it's full of lead, or I'm working in a factory trying to make a living and I'm breathing in lead and taking it home to my babies. So the first thing that they are feeling with guilt, you know, so, you know, even the emotional, that toll that it takes on a parent. And I'm always amazed at the parents always consider that they're in trouble now, you know, and they're curious if children's services are going to get involved. So it's even more than how it affects a child physically, you know, it goes on and on with those issues. So.
Do we have any other questions?
Hi, this is Eunice Glover, and I have it's more of a statement and something that I recall a nonprofit organization used to do as part of their maintenance and upkeep classes. What they did was they brought in a licensed and assured lead contractor and taught the families how to clean the house from, they taught them how to have a drop cloth, the clothes they wear, how they need to glove up and what they need to do in order to keep those window sills and areas where, you know, lead exposure was prominent. And it took about a good half an hour to 45 minutes. And it was such a fantastic demonstration. I'm just wondering if that is something that everyone would consider doing again, because it was so informative. The families love that. And, you know, when you empower people to, you know, take that, you know, you empower them to do things like that, it was a relief. It was such a relief. And one lady shared it with other family members, and the contractor was able to go into other, you know, homes and really sit down or come in and show them how to do that. And from start to beginning, and then, you know, how you had to toss those clothes, how to dispose of those clothes and certain things like that. So it was just a wonderful demonstration. And I hope that is something that they would consider doing again.
You know what, Ms. Glover, thank you so much for that comment. And I may want to have another conversation with you at some time. But with our Lead Coalition, we have just formed an education and community outreach subcommittee. And those are the kind of things that we want to do, because one of the things that we're finding is education is the key.
It's key.
And you know what, even my narrative on lead testing has somewhat changed, because we're testing 1,000 children and we're sending those 1,000 children back into their homes. So if parents are better educated, I'm so agreeing with that, they're less likely to, you know, raise a family in a home that is unsafe. So I do believe that
Right.
testing takes a second place to prevention and to education. So thank you for that.
Oh, you're so
one of the-
welcome. Thank you.
And one of the things that we do with our lead program, we do provide cleaning kits to our families, and that is part of our education, is to teach them how to effectively clean their environments.
All right. Yeah.
Now, who are you with again, Ms. Glover?
I'm with the Junction Coalition.
Okay.
Yes, I'm a
Okay. Well,
resident. Yeah.
Alicia's already on my list. I'll be attacking her next week.
Yeah. Okay. Thank you.
Thank you.
You're welcome.
Any other last minute questions? I do have a quick question, Ms. Gloria. I know you spoke
Yes.
about a few of the products that you would have seen, such as the toys, the cribs, the garbage tins, but within the specific community, I guess Toledo, that you've been working in, what is the number one item, that import item that you've been seeing a lot? Can you pinpoint
Toys.
the toys?
Toys. Yeah. And there, you know what? And now I think there are more toys that are not big brand names. And the majority of them, I'll have to say all of them have been imported from other countries. But I would say toys, and I would also say the little costume jewelry and the little trinkets. You know, something that really shocked me, you all, you know those Mardi Gras beads?
I have some.
Don't lick them. Don't lick them, Sanchez. You know, because that's the first thing kids do. We have found lead in those beads.
Yep, that is the truth. That is true. Yeah.
Because to think about it, when they do rub off, you do get that gray rubbery feeling.
Yes.
Mhm.
Yes.
Yeah.
And you know, yeah.
How do we find out what to look for? Is there a chemical that our family should look for when they're purchasing toys? Is there some, a name or something that we can have as an alert?
You mean as far as product name? Well,
Product
you know
name
what?
or chemical?
I'm not sure if I'm understanding the chemical. You mean when you're looking for a product to purchase?
Right. So with the crayons and lead crayons, they say this, all of what was used to make that crayon.
Mm-hmm.
There are some crayons that still have elements of lead in them.
Mm-hmm.
So with these toys, is there something that is an indicator that there may just be lead in those toys?
No,
Okay.
absolutely not.
Okay.
And you know what? You can purchase lead self lead kits in some of the big box stores, and you can always do your own testing yourself on certain products. But what I caution my families is look to see where it's been produced. You know, usually if it's imported, leave it alone. And I think that sometimes that's really difficult for us to do, because I think a lot of the products, there's beginning to be more products that are starting to be manufactured in the United States again, but still most of the products that we get are from, that are imported items. And also, I don't even think I mentioned this, people that do like antiquing and the rummage sales, we have to be conscious of those items as well, like old leaded crystal, china that's been painted, especially cookware and dinnerware that you're eating off of, just to be mindful of that. Now let me say this, one of the things too with those type of items, if they're chipped, is when they're more dangerous, once the paint have been compromised.
Definitely useful.
Thank you.
Definitely.
Yeah.
Useful information. So are there any other questions before we move on? Okay. So I'm going to move on to the activity that we have planned. So it's just something to get you all thinking and engaging. So what we planned was for you all to submit a photo, a poem, or a written script on how lead has impacted you. And so once you submit this to the email above, sanchez@freshwaterfuture.org, in the subject line, you can put punch in PB, which is punch in lead entry. And the deadline for this is August 10th at 5 p.m. And once you submit this, all submissions will be eligible to win a gift card. And so you can take a photo of this screen here. You can screenshot this. You can leave your message, your email in the chat. And definitely if you registered as well, we can send this out to you. So has everyone gotten a good picture of it before we move on?
And we'll post it on social media too. So, and I think we have most people's emails, so we'll send this
Yeah,
out
we'll
so you
send
can
it out.
share it with others even.
Yes. Okay, and so that brings us to the end, and I'm going to hand it over to Alicia for our vote of thanks.
Wonderful. Thank you so much, Sanchez. It is so important that we understand that lead has impacted our communities in a very adverse way. We are now doing some very important work with Blue Conduit, Freshwater Future, the City of Toledo. We're so very thankful to have this opportunity to have the health department and Ms. Gloria come on and engage us in such a way of providing information, education, and resources. Community, there's no other time that you can protect your families than right now. There's no other time that is important to get the information than to attend these webinars. Reach out to Mr. Sanchez at Freshwater Future, and the email is provided. And please visit our website at freshwaterfuture.org for all information, as well as the City of Toledo's website. We are partnered to ensure the safety of our children, our seniors, and our loved ones. Thank you so much for being with us. Thank you, Ms. Beatrice, for all that you're doing for our community. And Freshwater Future, thank you as well.
Thank you, Alicia.
Thank you.
Thank you.
Thanks, everyone. Have a great night.
Have a good one.
You all as
Thank you
well.
very
Good
much.
night.
Thank you.
Bye.
Good information.
Thank you.
Thank you.
Thanks, everyone.
Thank
you
you,
so much.
Gloria. That was
Fantastic job.
fabulous.
Thank
Really,
you.
really loved it. Loved it.
Thank you.
Yeah,
Yeah,
this
it
was
was
really, I think it's really nice to have this information that is
mhm.
straight what it is and what people are experiencing without speculating, without it's just what you're observing in your daily work. So
Yeah.
we really, really appreciate what you do. And again, thank you so much for being with us.
Yeah. And thank your daughter for providing extra support.
Yes. Yes. I'll have to give her an air hug. And thank you guys so much. You made it so easy for me. So
Good,
thank
good.
you. And you know what? I hope we can do something again real soon.
Oh yeah, we will. Don't worry.
Okay,
So,
thank you. I'll
from-
appreciate that.
Yeah,
You know
from
what? I
this
started to chime. I was getting hungry when Sanchez did the icebreaker. So I'm going for
I
Chinese
know.
now.
Okay, we'll let you go. We'll see you later.
Thank you. Good night.
Good night. We'll
Alrighty,
see everybody
take
else
care.
Thank
later.
you.
Thanks,
Bye-bye.
Beatrice. Thanks, Sanchez.
Bye,
Thank
Sanchez.
you.
Thank
See
you
Miss
again.
Gloria. You're welcome.
We'll see each other again.
We will,
We
definitely.
will. I feel it.
I
You
know
have
we
to
will.
bring Sanchez to Toledo.
Oh, yeah.
Pardon? Yes. You would really, you probably would like it.
Okay, I'm looking forward to it. I'm looking forward to visiting.
It's a cool city. We'll show you a good time, right, ladies?
That's right.
Yes. All right.
Yes.
Farewell, you all.
Okay,
Thank
good
you very
night.
much.
And this, take it,